I acknowledge the traditional custodians of the lands, seas and waters throughout Australia and pay respects to elders past, present and future. We recognise that the health and social and emotional well-being of Aboriginal and Torres Strait Islander peoples are grounded in continued connection to culture, country, language and community. So I'm joined today by Andy and Sandra from Health Workforce Queensland. Thank you both for joining me today to discuss working rurally and remotely.
No worries. Welcome. Thanks for having us. Glad to be here.
Thanks, Beth. So Andy, can you tell us a little bit about your organisation and what you do?
Yes, of course. So we're Health Workforce Queensland. We are a not-for-profit, non-government rural workforce agency. There's one of us in each state and territory, and our jurisdiction is Queensland. So we've been around for about 20 years now, and our purpose is to create sustainable health workforce solutions that meet the needs of remote and rural and Aboriginal and Torres Strait Islander communities. And so we do this by focusing on access to primary care, as we know that improving access to primary healthcare workforce will ensure sustainable and healthy rural and remote communities. We also do this by increasing the quality of the existing rural workforce, and that we do by providing support for upskilling opportunities. And we focus on the future workforce, so our students. We promote rural health careers to our students by supporting rural placements, university placements, and we have a wide variety of rural immersion programs to give students a little bit of a taster of what it's like to work in a rural setting. So those are the main things that we do as a company.
Fantastic, that's great. And what do you have to offer to speech pathologists who are new to the field and looking for a rural career?
We are Commonwealth funded and specialise in recruiting appropriate healthcare workforce to primary health services and Aboriginal community controlled health organisations in rural and remote Queensland. Our services, recruitment wise, are free of charge and include recruitment of allied health professionals amongst other professions. We can support early career and experienced speech pathologists to find suitable positions in rural Queensland. We can assist with placements in MM2 to 7 locations, that's modified Monash model, classification system, and Aboriginal community controlled health organisations in any location in Queensland. We have over 20 years of experience in recruitment of rural health professionals and can provide expert knowledge, guidance and advice regarding skills and suitability for rural positions, as well as job matching services. Ultimately, we can help you find a rewarding career in Queensland and match you to a suitable practice in rural area. Full support is available to new graduates and early career professionals to find a position where they can be fully supported and progress their careers. So we find you a placement, but we also want to retain you and make sure that there's job satisfaction and that you have mentorship and peer support and everything that a young health professional needs. We work with multiple organisations who are providing allied health services. That includes speech pathology practices, multidisciplinary allied health practices, Aboriginal community-controlled health organisations, and other primary healthcare providers. So we'll match you to a position where you feel comfortable, where you have adequate support, and where you can progress your career as a clinician and potentially as a future leader in your profession. So in order to support your move, once you have accepted a position in rural Queensland, we can support your move and settlement into your new rural communities, and to ensure job satisfaction, we offer a range of incentives. So these include incentive relocation packages, orientation to your rural community, ongoing case management, support following commencement, cultural awareness courses if required to orientate you to the community, ongoing career pathway support and grants through our Commonwealth funded programs. Incentive relocation packages are subject to funding availability and eligibility criteria being met. But these packages are allocated based on our health workforce needs analysis findings and identified priority professions. Speech pathology is a priority profession in rural Queensland, so we would be able to offer this support. And as I mentioned, relocation packages can help you with some of the rental assistance or relocation costs or travel. These are pretty much tailored to suit your needs as a health professionals when you're making the move to rural communities. So if you're interested in exploring employment opportunities in rural Queensland, the next step for you would be to either apply for advertised vacancies on our Health Workforce Queensland website. You can alternatively send us your CV if you're a speech pathologist to our hws@healthworkforce.com.au email address. And also wanted to mention that we also run multiple targeted allied health recruitment campaigns that are accommodating for new grads and happy to support them in their roles, as well as experienced speech pathologist professionals. So we do have also tailored incentives relevant to each campaign, and these are in various geographic locations in Queensland. So if you would like to find out more, contact our Health Workforce Solutions team. We'd be happy to support you.
Fantastic. If someone is looking into postgraduate study, what support do you have to offer them?
Health Workforce Scholarships Program is the initiative of the Australian Government Department of Health, and this particular program is administered in Queensland by Health Workforce Queensland. So it provides scholarships and bursaries to help health professionals at any stage of their career. It could be early career speech pathologist or experienced speech pathologist who are providing services in remote and rural Australia in Triple M 3 to 7 locations or Aboriginal community controlled health organisations to apply for scholarship support and enhance their skills, capacity and scope of practice. So these professionals are eligible to apply for a payment up to $10,000 per year for a period of up to 2 years. So this is for postgraduate courses leading to postgraduate qualifications. So some of these courses, for example, are postgrad certificate, postgraduate diploma, master's or PhD. You could also look into applying for the Allied Health Rural Generalist pathway, because it may help you expand your scope of practice and upskill significantly. So there are various options there if you want to progress your career and apply for additional qualification, and you are in an eligible location, you can apply through the scholarships program, and application is available on Health Workforce Queensland website.
Fantastic, that sounds excellent. And do you have any continuing professional development opportunities available or funding to engage in this?
Yes, we definitely do. So the same scholarships program also offers bursary support, which is also $10,000 per year for a period up to 10 years. So the difference is scholarships, support postgraduate qualifications, whereas bursaries gives you flexibility to choose what you need to enhance your skills and capacity and scope of practice. So eligibility is the same, includes health professionals providing services in Triple M 3 to 7 locations and Aboriginal medical services in any location. So health professionals providing services to these areas are eligible to apply. Bursaries could be used for an accredited industry conference, accredited industry conference attendance. So that would cover the course, or the conference fees, and accommodation and travel could be also included in the application. Any vocational education, online workshops and training courses could be covered through this. So it's a bit more flexible, and tailored to suit your needs. And as I said, $10,000 per year. So any 12 months period, you can access that, and then you can reapply the following year for additional $10,000 upskilling. So it's significant support for somebody at the early, stages of their career when they want to make sure they, have adequate skills, and especially if they're in rural communities, so they can provide, good quality service. So we can also assist with provision of grants for health professionals through our elements of funding. So this is in instances where the proposed upskilling is not meeting scholarships program criteria, or is going to make a significant difference to the rural community, and they need that set of skills on the ground. So willing to consider those grant applications as well. And another option to apply for continuous professional development is to include it in your incentive relocation package. So it is tailored to suit your needs if you secure a position in Queensland, and you can include some of those activities in, that package, and we will fund that as well.
Fantastic. That's excellent. So if you had to give 3 reasons to go rural, what would they be?
Yeah, so it's hard to narrow it down, but there's a lot of good reasons to go rural. But I think the things that we get back from the people we've placed in rural locations and from our stakeholders and the communities that we speak to on a daily basis is the scope of practice. So the scope of practice in rural communities is normally a lot broader. In most towns, there's a very close connection between disciplines, and it creates more opportunities and exposure to increase your scope. And what we've noticed from people that we've placed is their confidence grows very rapidly in as little as a couple of months, just by the sheer fact that their knowledge increases so fast, and they just have so much more exposure to a wide variety of patients. The other thing that we get back a lot is the connection with the people in the community. Depending on where you go, most people in these smaller rural towns know each other. So what you'll see is when you've helped someone, when you've treated a patient, you get to see the results and the impact that you have on their lives, right? Because you run into these people again and again and again. So there's a lot of satisfaction comes from that, but also you get a lot of gratitude from the people, and you notice that rather than treating them once in a big city and never seeing them again. And then last but not least is the lifestyle. So the country lifestyle, is very outdoors, very active, very family focused, very safe. So we get that back a lot, and that's probably why people stick in these communities. Often, you see them moving to the communities with a sort of 1 or 2 year plan in their minds, but they just stick around because they just fall in love with the lifestyle. And so those are definitely the 3 key reasons, I think.
Fantastic. Really great response to that question. So thank you so much, both of you, Andy and Sandra, for joining us today and sharing your information. Thank you so much.
You're very welcome. Thanks you for having us.